Did you know that magnesium is crucial for over 300 different biochemical functions within your body? These can be anything from high blood pressure regulation and nerve function to generating energy for your body. Hi viewers, and welcome back to another Bestie video. While magnesium may not be as popular as other minerals like calcium and iron, it's just as important for your body. Since it's responsible for so many bodily functions, a magnesium deficiency can be detrimental to your health. So it is very important to identify the signs of magnesium deficiency so that you can correct it before it manifests into diseases like diabetes, poor absorption, chronic diarrhea, celiac disease, and hungry bone syndrome. In today's video, we'll tell you the signs that your body's starving for magnesium. From asthma, high blood pressure, fatigue, sleep problems, to twitching eyelids, and more. Watch till the end to know about all the symptoms. Number 1. Sleep problems. Melatonin, chamomile, lavender, they're all things that can help you snooze peacefully. However, magnesium is the ultimate relaxation mineral. Magnesium helps to relax your mind and body, both of which contribute to a restful sleep. Furthermore, magnesium is required for proper functioning of the GABA receptors in your brain. GABA is the neurotransmitter that allows the brain to transition to a restful state, giving you a more peaceful sleep. Do you have trouble sleeping? How long does it take you to fall asleep from the time you lay down on your bed? Tell us in the comment section below. Number 2. Osteoporosis. You likely know that vitamins can lessen your risk of developing osteoporosis, specifically vitamin D and K. But magnesium-deficient people are also at a higher risk for developing this condition that weakens your bones and puts you at a higher risk of fractures. But getting enough magnesium can help in more ways than one. Adequate magnesium intake is associated with higher bone mineral density and can also prevent hypocalcemia, which is a condition in which your blood has very little calcium. Though magnesium or lack thereof can act directly on your bones, it also affects their strength by causing a lack of calcium. Number 3. Muscle spasms and cramps. With the rise of workout culture, more people are aware that muscle cramps are a sign of magnesium deficiency. Magnesium plays a crucial role in helping your muscles relax and regulate muscle contractions. You might have tried an Epsom salt bath after an intense gym session, which is another form of the important mineral, magnesium sulfate. And a deficiency can cause physical effects far beyond cramping, like tremors and even seizures. Unfortunately, for older adults experiencing muscle cramping, getting rid of muscular discomfort isn't as easy as supplementing with magnesium. Although studies have shown that the mineral can help relieve cramps and twitches in other groups of people that are deficient, magnesium deficiency can also cause a secondary deficiency, hypocalcemia, or a lack of calcium, which can also cause muscle spasms and cramps. Number 4. Mental disorders. Mental disorders are another possible consequence of magnesium deficiency. These include apathy, which is characterized by mental numbness or lack of emotion. Worsened deficiency may also lead to delirium and coma. Additionally, observational studies have associated low magnesium levels with an increased risk of depression. Scientists have also speculated that magnesium deficiency might promote anxiety. One review concluded that magnesium supplements might benefit a subset of people with anxiety disorders. A lack of magnesium may cause nerve dysfunction and promote mental problems in some people. Number 5. Calcification of the arteries. Unfortunately, this is one of the first symptoms to appear and one of the most serious. Calcification of the arteries can occur from low magnesium levels. These can lead to an increased risk of heart problems, like heart attacks, heart failure, and other diseases. Magnesium's ability to prevent overcalcification is one of the reasons why studies found that eating enough magnesium lowers the risk of coronary heart disease. Believe it or not, half of all heart attack patients receive injections of magnesium chloride to help stop blood clotting and calcification. Number 6. Fatigue. Fatigue and exhaustion are a couple of generalized symptoms of magnesium deficiency. Sometimes you may attribute your tiredness to stress, poor sleep, or a host of other reasons and not realize just how much nutrition is playing a role. According to research on chronic fatigue syndrome, magnesium provides nutritional support to combat fatigue. This is because magnesium is required for the production of energy in your body. If your body has inadequate access to magnesium, then energy production suffers, leaving you prone to fatigue. Number 7. Migraines and headaches. A migraine is the 6th most disabling illness in the world. causing hours or days of recurring pain, sensitivity to light and sound, and even nausea. A large body of evidence has found that magnesium, whether administered orally or via IV, can be an effective and inexpensive option for providing nutritional support in the management of migraines. Although the mechanisms aren't fully understood, it is known that maintaining a normal magnesium level helps preserve the electrical function of the brain neurons. Number 8. Irregular heartbeat. Magnesium is a mineral and electrolyte that your body needs to maintain normal nerve and electrical impulses of the heart. Heart flutters, elevated or slow heart rate, and racing heartbeat are all signs of possible magnesium deficiency. In addition, reduced magnesium intake as well as low serum levels have been shown to have an adverse effect on multiple aspects of heart health. According to research, an extra 100 milligrams of magnesium a day in your diet was associated with better heart health. Number 9. Blood sugar spikes. Although blood sugar levels are no doubt heavily influenced by what you eat and how much energy you expend, surprisingly, they're also influenced by magnesium levels. This is because magnesium assists your body in glucose and insulin metabolism. A large 6-year study found that low serum magnesium levels were associated with insulin resistance and a risk of prediabetes. In addition, it found that common variations in magnesium regulating genes that cause low serum magnesium were associated with increased risk for diabetes. Unfortunately, the onset of diabetes might compound the problem because it increases urinary magnesium excretion. Number 10. High blood pressure. Magnesium works with calcium to support healthy blood pressure and heart health. High blood pressure or hypertension can be a sign of magnesium and calcium deficiency. And since hypertension is the cause of 50% of all ischemic strokes, it's best to practice preventative medicine and get enough of magnesium. A study found that a diet rich in magnesium may reduce the risk of stroke by 8%. Another study tested the effectiveness of magnesium supplements on patients with heart disease and found that heart disease patients who took magnesium twice a day for 6 months had better physical stamina and healthier blood vessels. Number 11. Twitching eyelids. Magnesium deficiency may be the underlying cause of muscular tics. One of the first signs of magnesium deficiency is tics of the eyelids. Supplementing magnesium may alleviate these by improving the electric conduct of the nerve impulses at the junctions between the nerves and muscles. Number 12. Tingly extremities. A function of magnesium is that it makes sure that your nerves and muscles are constantly firing as intended. Regularly experiencing the opposite may be a sign that you aren't taking in enough on a regular basis. Persistent numbness or tingling in the fingers and toes or limbs, often feeling like they're falling asleep, could indicate that your body doesn't have enough magnesium to optimally conduct your nervous system's functions. Number 13. Asthma. Asthma patients tend to exhibit magnesium deficiencies with greater frequency than is typically seen in healthy, non-asthmatic individuals. Researchers generally attribute this finding to a belief that lower magnesium levels cause improperly absorbed calcium to build up in your muscles lining the airway to the lungs. As a result, those passages constrict and hinder normal breathing. This is why patients diagnosed with severe asthma are often given magnesium sulfate inhalers to instantly expand and relax the airways in emergency injections to combat life-threatening symptoms. Number 14. Stress. Life can be stressful and there's no getting around it. Emotional and physical stress can both cause magnesium deficiency. Even things like surgeries, chronic diseases, medications, and traumatic life events can play a part. In times of stress, your body will need more magnesium than usual. If you're already low, stress can exacerbate the problem. Also, the stress hormone adrenaline and cortisol can increase when magnesium levels are low. Do you get stressed a lot? Find out how you can deal with it by watching this video titled 11 Vitamins and Supplements You Should Take for Stress Relief. Now, back to magnesium deficiency symptoms. Number 15. Seizures without an existing condition. Consider this one of the most severe potential signs of magnesium deficiency. Several conditions can cause recurring seizures, but they don't typically occur completely at random. Scientists believe sudden unexplained seizures may be caused by dangerously low magnesium levels because a significant lack of a mineral can cause abnormal electrical activity in the brain. Experiencing a seizure absent any other recent symptoms may indicate a need for a dietary overhaul, magnesium supplementation, and possibly a few lifestyle changes. Number 16. Vertigo. Magnesium helps to regulate the levels of other minerals in your body, such as calcium, potassium, copper, and zinc. Lack of magnesium can therefore increase your risk of developing an electrolyte imbalance, which can lead to dehydration, dizziness, and cognitive decline. If you often feel fatigued, dizzy, or lightheaded, then be sure you stay hydrated by drinking plenty of water. Try adding a magnesium supplement to help reduce some of these symptoms. Have you ever faced magnesium deficiency? Which of the symptoms that we mentioned did you get? Let us know in the comment section below. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.